Hi everyone, I'm Dr. Gitika and I'm consultant and obstetrician and gynecologist at BLK Max Delhi. So today we'll be talking about urinary tract infection in females. As we all know that UTI, that means urinary tract infection, is quite a common problem in females. Why it is more common in females and not as compared to males? So the first thing is that the proximity of the urinary opening is very close to the vagina and anus in females when we compare it to males. So any infection of the vagina or the bacteria of the anal area can easily migrate to the urinary opening and cause the infection. Secondly, the length of the urine pipe which carries the urine out of the bladder to outside, it is comparatively smaller in females. It is around 4 centimeters in females. That's why the infection in females, they are more common when we compare them to male. The second thing is our urinary tract consists of 3 or 4 parts. These include 2 kidneys, urinary bladder, the pipes which carry urine from the kidneys to the bladder, that is, they are known as ureters, and the pipe which carries the urine from the bladder to outside is known as urethra. So the infection anywhere along this tract is labeled as urinary tract infection. What are the symptoms of urinary tract infection and why it occurs? In female, it can occur if you are not drinking enough fluids. Or if you are holding your urine when you have urge to pass urine. Holding the urine can create a media for growth of the bacteria. So it is always advised whenever you feel like peeing, you should go and pee and not hold the urine. This is very important. And drink adequate amount of fluids, because the fluid water, it flushes the bacteria out of the urinary tract. Again, sexual activity is also one of the risk factors, as I told, because the vaginal opening is very near to the urinary opening. Then low immunity, in the sense if the patient has diabetes, she is pregnant, she is on any antibiotics, is another risk factor which can lead to urinary tract infection. What are the symptoms now? A person with urinary tract infection will have pain in the lower tummy. She may have urgency to pass urine, that is, she will have frequent desire to pass urine, but once she goes to pass urine, she is able to pass only a small amount. There can be burning in the urine or pain while passing urine. If it is a severe infection, there can be fever with chills as well, and it is a high-grade fever. Then there can be other symptoms and signs like the urine can be yellow in color, it can be cloudy in nature, or it can be smelly as well. Now, how to treat it? Once you suspect that you have these symptoms, you should always meet your gynecologist. She might offer you 2 tests, that is urine routine microscopy and urine culture sensitivity. Urine routine microscopy is done to see whether there are any pus cells in the urine. And urine culture sensitivity tells us what bacteria is growing in your urine. There is a special technique how to collect this urine, and this is known as midstream urinary collection. That is, you allow the first part of the urine to pass, then the middle stream of the urine you collect in the vial or the container, and the last part of the urine also you discard. While collecting the urine, it is important that the vial or the container should not be touching your private parts. How to treat urinary tract infection? Well, there are certain measures, general measures, like drinking lots and lots of fluids. These fluids can be in the form of juices, water, or you can go for buttermilk, lime juices. So any form of fluids, you should be drinking at least 3 liters of fluid a day. If you have pain, your doctor will prescribe you some antispasmodics as well. And if it is too much of burning in the urine, then you will be prescribed with alkalizers. This is mainly in the form of syrup, which makes your urine alkali in nature, because it is mainly the acidity of the urine which is causing you burning. Then, depending upon the culture report, the doctor will prescribe you a short course of antibiotic, and this will be for around 5 to 7 days. Certain precautions which you should follow to prevent urinary tract infection. As I told, drink lots and lots of fluids, at least 3 liters of fluid a day. Whenever you are going for peeing or passing stools, when you are wiping, always wipe from front to back. If you are indulging in sexual activity, always clean your private parts before the sexual activity, and after the intercourse, always pass urine. You can go for eating some cranberries, cranberry juices, which are also found good to prevent urinary tract infection. I hope this video was helpful to you. Thanks for listening.